One of the first things that we put in I want to say it's on the first page of our CHA, is the quote from the IOM that 70% of health outcomes are due to living and working conditions. We wanted to set that stage right up front in our CHA and our CHIP.
Different things besides behavior and family values can influence health.
What we have really found is the biggest factor that we need to pay attention to is income, economic level. And across the board, we saw that those with lower income had worse health outcomes and were the ones really experiencing barrier to health services, experiencing barriers to getting fresh fruits and vegetables. And so we're trying to take a look at how we can better target that population.
As we developed our 5 main goals, one of them is to address social determinants of health. And so when we looked at that, it seemed a little generic. And so what we did was we wove it into 3 of the other topical areas. So we have a topical area looking at healthy living, eating and physical activity. We have one looking at early childhood, and we have one looking at mental well-being. And so what we're doing is we're trying to make sure that we are addressing underlying social conditions that impact those 3 health areas.
Our access to health services implementation team is very, very focused on disparities, has several specific deliverables related to disparities, and their business plan is quite clear on that. Actually, our intent for them is for them to morph into a 501c3 nonprofit sometime in early 2014 so that we can raise additional resources for the project.
We also used what is called the Health Impact Pyramid, and with that, they talk about at the foundation, you really should address the social economic factors when you're looking at community health improvement. And so you want to take more of a population approach rather than an individual approach, such as education or counseling, to really make sure you have the mass effect that you want with community health improvement.